You wake up at 2 a.m. Then again at 4. Every single night. You shuffle to the bathroom in the dark, half asleep, holding the wall for balance. You climb back into bed. You close your eyes. And just when sleep starts to pull you under again, your bladder calls. Again. You've told yourself it's just age. That this is what getting older feels like. That broken sleep is simply the price of living long. But what if I told you, a urologist told you, that for millions of seniors, the real problem isn't age at all. It's when you drink your water. Dr. David Schusterman, a board-certified urologist with over 2 decades of experience, says one of the most common, and most overlooked, causes of nocturia in seniors is improper hydration timing. Nocturia. That's the medical term for waking up 2 or more times a night to urinate. And it affects nearly 70% of adults over the age of 60. But here's what nobody tells you at the doctor's office. Your kidneys don't work the same way they did at 35. As we age, the kidneys lose some of their ability to concentrate urine efficiently. That means if you're drinking large amounts of water in the evening, even healthy, clean water, your body processes it at night, while you're trying to sleep. It floods your bladder. It wakes you up. Night after night after night. And the cruel irony? Most seniors actually underdrink during the day because they're busy, or they forget, or they've been told to cut back to sleep better. So by evening, they're dehydrated, and they drink more to compensate. Right before bed. That's the cycle. And it's quietly stealing your sleep, your energy, and your quality of life. Here's the first rule Dr. Schusterman gives every senior patient who walks into his office with this complaint. Front-load your water. Drink the majority of your daily fluids before 5 p.m. It sounds almost too simple. But the science behind it is profound, and once you understand why it works, you'll never forget it. Your body has an internal clock. A biological rhythm that governs almost everything, your temperature, your hormones, your digestion, and yes, your kidneys. This rhythm is called the circadian cycle, and your kidneys follow it faithfully. During the day, your kidneys are active, efficient, and fast. They filter blood, balance electrolytes, and push fluids through your system with purpose. But as the sun sets and your body prepares for rest, kidney activity slows down. It's supposed to slow down. That's by design. So when you drink a large glass of water at 9 p.m., you are essentially handing a slow, winding down system a full load of work. And that work, processing that fluid, filtering it, sending it to your bladder, happens right in the middle of your deepest sleep window. Dr. Schusterman recommends seniors follow what he calls the 2-2-2 rule. Stop all major fluid intake 2 hours before bed. Use the bathroom 2 times before lying down, once after dinner, once right before sleep. Keep a 2-ounce maximum sip of water on your nightstand, only for medications or dry mouth. That last bathroom trip matters more than most people realize. Think of it as emptying the tank before a long drive. Your bladder has a capacity, and the fuller it is when you lie down, the sooner it reaches the threshold that wakes you up. A deliberate pre-sleep void, even if you don't feel a strong urge, can add 1 to 2 full hours of uninterrupted sleep. But water timing isn't just about when you stop. It's about how you drink throughout the day. Sipping slowly and consistently, small amounts every 30 to 45 minutes, is dramatically better for seniors than drinking large quantities at once. Here's why. When you drink a full glass or bottle rapidly, your kidneys get a sudden surge of fluid they must process quickly. But when you sip steadily, your body absorbs water more efficiently at the cellular level, and less excess fluid reaches the bladder all at once. Think of it like watering a plant. A slow, steady drip reaches the roots. A sudden pour just runs off the surface. There's also something most seniors have never been told about sodium and nighttime urination. A high-sodium dinner, salty soups, processed meats, canned foods, causes your body to retain water initially, then dump it hours later. right around 2 a.m. That salty meal you had at 7 p.m. could be the reason you're awake at 2. Reducing sodium after 4 p.m. is one of the simplest, most underused strategies in senior sleep health. There's one more piece of this puzzle that deserves its own moment, because it changes everything. Leg swelling. Many seniors, especially those who sit for long periods or have mild circulation issues, accumulate fluid in their legs and ankles during the day. You might notice your feet look a little puffy by evening. You might not notice at all. But when you lie down at night, gravity is no longer holding that fluid in your lower body. It redistributes. It travels back into your bloodstream. Your kidneys pick it up. And your bladder fills. This is called positional fluid redistribution, and it is one of the leading hidden causes of nocturia that even many doctors miss. The solution is surprisingly elegant. Elevate your legs for 30 to 60 minutes in the late afternoon, not at night, but before dinner. A recliner, a pillow under your feet, a short rest on the couch with your legs raised. This allows that pooled fluid to drain before bedtime, so your kidneys process it while you're still awake, not while you're trying to sleep. Compression socks worn during the day serve the same purpose. They prevent the fluid from pooling in the first place. Combined with front-loaded hydration, the 2-2-2 rule, steady sipping, reduced evening sodium, and afternoon leg elevation, seniors who follow these steps report dramatic improvements. Not in weeks. Often within 3 to 5 days. Your body is not failing you. It has simply been asked to do the wrong things at the wrong time. And the beautiful truth is, it responds quickly when you give it the right conditions. You deserve to sleep. Fully. Deeply. Without interruption. You've earned that rest. If this helped you or someone you love, please give it a like. It truly helps more seniors find this information when they need it most. Drop a comment below. Do you struggle with nighttime trips to the bathroom? Share this with a family member who might need to hear this tonight.